So, good morning, everyone. Sadly, we lost two more Albany County residents to the virus last night. They're both residents at St. Peter's Rehabilitation and Nursing Center. There are two males, one in his 80s and one in his 90s, with both multiple underlying health conditions. To the 124 families, my prayers and condolences goes out to you, and to the two new families, my prayers and condolences go out to you. It's a tough time. That brings us up to 126 people that we've lost in this county to the COVID-19. More difficult times in the beginning than it is now to say goodbye to your loved one, but it's still not easy in these tough times, especially if they're in a nursing home. As you know, most nursing homes you still can't visit, not unless you have a negative case for 28 days, and that has not been the case that I'm aware of for any of the nursing homes in the Capital District, or I should just say in Albany County. But again, to the families, listen, our condolences and prayers, and we're thinking about you. So as of today, there's 2,261 positive cases of the coronavirus in Albany County, 759 people under mandatory quarantine, and today we have an increase of 20. When I was talking yesterday and our number dropped a little bit, I was hoping that we were going to start going back down again, but unfortunately we went back up to 20, and that seems to be in the ballpark where we've been at lately on the average between 13 and 20. There are 5 cases involving healthcare workers. As everyone's aware, the nursing home and hospital workers have to get tested once a week now instead of twice. So 5 cases involving healthcare workers. 2 positive cases reported from travelers outside the New York State into areas that they shouldn't have gone into. And 4 have close contact to positive cases. And 6 don't have a clear source of infection yet, so they're working on that, doing the mapping and tracing. One of the things that we identified too, we have 3 have been linked to Hudson Avenue, the cluster there. So that brings that total up to 43 now, so 3 more. And, one of the questions we keep getting constantly is, well, why are we getting more positive cases? Why are we seeing the link to this? I want to say this to the University of Albany and to the students and to the kids that live in that area. Thank you. They're coming forward. They're getting tested, and they're identifying who they are. Again, we're not looking to find them. We're not looking to get them in trouble with the schools, but this is the ripple effect that you have. And if you had more people in clusters like this coming to get tested, you would probably see more numbers like this, unfortunately. Again, not picking on the 20 to 29-year-olds, but they have no symptoms, and they don't feel like they should get tested. So if more of them stood up, I don't agree with these kids did, but they're doing the right thing now. So I applaud them for doing the right thing in the university. Rodriguez as president, Javidant, and thank you for what you're doing there in making sure that the students are doing the right thing. So as you can tell, this party was July 4th. And here we are all these days later outside the 14-day window, and now we're up to 43 people. And there's probably a lot more from that party we're not aware of, because there'll be some people that won't come forward. So as of today, there's 84 active cases in Albany County. We have 6,972 people that have completed quarantine. Of those, 2,177 tested positive for the virus have recovered. If you notice, that number's a little bit different from yesterday, the 6,972, because the state DOH and ours, they cleaned that up. So there's people they're counting still after all this time, 20 weeks later, almost 21 now. They're counting people outside the county, so it took off 109 off our count. So that's why you see the difference, because yesterday we were at 7,081. Today we're at 6,097. So there was 109 people that shouldn't have been on our list, should have been on other lists, but they straightened it out, and they continue to fix it as we go forward. So we have an increase of 18 recoveries from who tested positive, which is good. We have 3 people in the hospital with the hospitalization rate, same as yesterday, 0.13%, which is good. And no one currently in the ICU, which is also good news. Yesterday the number was 1, today is 0. So, and yes, the 2 people that passed away weren't in there, so that's not included in there. So over the last 5 days, there's been an average of 14.2 new positive cases. Yesterday's average, the last 5 were 14.6, so that's down, which is also good. Again, we continue to encourage everyone to get tested. It's so important. Listen, you're going to fill out the thing online if you go to Albany, and if you don't have any signs or symptoms, they're still going to call you probably within that day or next day and set up a testing time for you. We are encouraging people to get it, and again, I can't debate with people on Facebook or send us emails. Our hospitalizations rates are down, so look, it's still a serious condition to have. People that have recovered from this are going to have long-term effects. People that were intubated for long periods of time will probably need lung transplants, are going to have lung issues going forward, organ issues going forward. They're not out of the woods even though they recovered. They have a long road ahead of them for recovery, and health issues they're going to have the rest of their life. It's better than the alternative of them passing away, but again, it's something that cripples you for a long time. And then now the CDC came out with some of the effects it could have on people's heart, the coronavirus that don't show signs and symptoms, but might have had it, and the effect on that. So again, as it changes and continues to change, it's out here. It hasn't gone away. So I say to everyone listening to this or watching this, please just do the right thing. Just do the right thing. So if you want to get tested by appointment, testing sites at UAlbany, 1-888-364-3065. Our mobile testing sites, please, I encourage everyone to come out. That number is 518-465-4771. And for Rite Aid in Colony, go online, you fill that out through Google app, and you can get an appointment with Rite Aid. And Purdy One in Gilliland, as always, our good partner there on the town of Gilliland. Antibody testing, you can call 518-867-8040. Again, just remember the four things. It's basic. Wear your mask right. Wear it over your nose. Cough into your arm. Clean your hands. And stay 6 feet apart, especially if you're not in that group of people that you've been hanging out with. And I know there's certain groups, like even in my neighborhood, families that have been together since day one. I get it. You should hang out. You're doing the right thing. You did the right thing. You're keeping that circle tight. That's what it's about when you're with family. So the same thing. Anyone traveling or not traveling to one of the 34 states now on our quarantine list, you need to quarantine for 14 days. So the governor just added more of states to this in 2 territories. Territory of Puerto Rico now, the CDC had it out. Now it's on the governor's list. Puerto Rico, District of Columbia, Illinois, Kentucky, and Minnesota now are on that list. So if you're traveling to them and the other states, please, by all means, you come back. One of the questions we keep getting, if you get tested and comes back negative, they still want you to quarantine for 14 days. All right, it doesn't mean because you got a negative now you can bounce out of your house and everything's good. It just means that you could still get it a couple days from that. It just means at that time you didn't, you're showing negative. And so please, by all means, just do the right thing. If you want it to go to these states, you shouldn't, or these territories, and you shouldn't be there. Please, by all means, just do the right thing when you come home and quarantine for 14 days. I don't think that's really requesting a lot out of you. It's just working with us in a partnership so we can all get through this. So we would appreciate that. One thing we've been talking a lot about during the last few months is the kids haven't been able to go to school, access regular food programs. I don't think a lot of people realize the breakfast, lunch they get at schools every day. The schools have done a great job making meals available. They've been delivering them. They've done a good job in Gilliland, Albany, Colony, all throughout the county, making sure that these families that get food and continue to get the food through this epidemic that we're going through. We've had great partners like United Way, the Regional Food Bank, Northeastern New York, South End Children's Cafe, Feed Albany's done a great job, just to name a few, and I know there's a lot more out there, but I just want to put a few of them out of them. But our food pantries are open, and creative things are going on into the communities. Pop-up free production stands are out there. They're really getting the message out there, and I thought it'd be good to have the executive director of the food bank come in from the Capital District to talk about this, because it is safe to go to the food bank. They're doing it safely. They want you to come and get food. So Natasha, if you want to talk about that and let us know, that'd be great.
Great. I want to thank you so much, County Executive McCoy, for having me here today. The Food Pantries for the Capital District is a network of more than 65 food pantries who provide food services throughout the year, every year. And right here in Albany County, we work with 32 member food pantries. Last year, just to give you a sense of how many people typically seek assistance from food pantries, the food pantries in Albany County provided more than 23,000 people food more than 147,000 times last year. So that was a regular year. This year, what we've been seeing regionally is when the COVID-19 pandemic started, nearly 50% of food pantries in our region were experiencing extreme increases, some even experiencing 150 to 200% increases in services. However, there are other pantries who are seeing decreases, and we have been talking to our member food pantries as well as community members out in need at our outreach events this summer, and what we're hearing is that people in need of food assistance either don't know where food pantries are in their neighborhood, don't know what a food pantry is, or they think that their food pantry is closed. And what we'd like to share with you today is that all of the food pantries in our coalition are open. They have taken new precautions and different practices to maintain social distancing and safety. One example is the Bethlehem Town Hall is closed. However, the food pantry is actually open. And so this is really important for people in the community to realize. The other piece to this is that how do we help people who are vulnerable? They're not able to leave their home, they're in quarantine. And I want to really thank all of the representatives that we've been working with here at Albany County on coming up with some sustainable solutions to help our vulnerable community members. And one opportunity is that we've been working with volunteers, with our member food pantries and other community groups to come up with home delivery options for those who are vulnerable and those who are under quarantine. We want to make sure that people are aware of this, that if you are at home, you're unable to get out, and you do not have resources to get your own food, please call us at the food pantries and we can help you connect to food assistance services. The other area that we are trying to connect people right now is through our Food Connect mobile outreach program. They are free pop-up produce stands to help get people access healthy food. But the other thing we do at those sites is connect people to food resources, and we hand out our basic needs resource guide. So not only are you getting food resource information, but other basic needs and health information as well. So if you, the best way to start, if you have a website or if you have access to the internet, you can go right to our website, which is thefoodpantries.org. We have a map that shows all of the food pantries, their hours of operation, their phone number. It's always a good idea to call ahead of time just to understand what their procedures are, if they're setting appointments or doing a drive-through schedule. If you don't have access to the internet to view the online resources, you can call our phone number Monday through Friday from 8 to 4 p.m. at 518-458-1167, and our food access referral specialists will help connect you to food pantries. But we also have information on other services as well. We have the listing of the summer meal sites on our website, and our food access referral specialists can also provide that information. For those of you who are not in need of food right now and would like to help, volunteer, donate, get involved in some way, you can also go through our website or call us. We are in need of volunteers. We have both remote and on-site volunteer opportunities throughout the Capital Region, especially this summer. So I want to just mention what is a food pantry for anyone who might not know. Food pantries are not income-based, it's based on your need. So for individuals who might be struggling, who are temporarily laid off or don't have the hours that they normally do, you can still seek assistance from a food pantry. You go home with a minimum of 3 days worth of grocery items. Some pantries have household products. We also carry diapers and formula for those in need as well. So, working together, we can do more than any one of us alone. And we have really seen that, especially now during this pandemic and an economic crisis happen here in the capital region. I just want to take a moment again to thank Albany County, all of your representatives. I want to especially thank all of the food pantries, the volunteers and staff that run them. They've been incredible, and we're continuing to prepare for the long term in a sustainable, systemic approach to making sure that these food access resources are there consistently and reliably. So again, food pantries are open. If you need assistance, check our website or give us a call, and we will make sure that you have your food needs met. So thank you so much.
Thank you, Natasha. But I do want to say, it's going to be difficult times now that people lost to $600 a week. It's going to change the income base, and unfortunately, we're going to see things not reopen. And what's going to happen is more and more people are going to get laid off. Or, I was talking to a couple hotels now; they're not doing banquets. Most of them canceled that they had for the rest of the year. So that whole staff's going to be laid off, sales and everything else. So people need this at a time. So thank you for always being there in the community. I think the only time you hear are times of crisis, but even when things are going good, there's still people that need food pantries and they need this help. So thank you for being the fabric of our community and the backbone of our community, making sure that people get the food that they need and deserve.
It's our honor. Thank you.
So, as we're talking about reaching out, one of the things that I did yesterday, we have 1,000 people that are joining the census, going out in the community, something we should have been doing months ago, but we couldn't, right? We were all shut down, so no one could be out. So now we have people that are being trained at our Times Union Center. It's a partnership with the federal government who hired a bunch of people to go out and do the census. Why is it so important to get counted, and especially more now than ever before? And I'm just, we've talked about this, we hit on this, but now the fact that it looks like we're not going to get a stimulus package 5 to the counties and barely to the state, and the governor's done a great job championing the argument, you know what? We're going to be in trouble when that money doesn't come in. We're going to be in a lot of trouble. What's going to cause more problems is the census, right? If we don't count everybody, what happens? Again, we end up losing representatives in Congress. So we get less voices in New York State. We've lost Congress persons now for the last consecutive 30 years. Every 10 years, we end up losing people because our numbers are going down. So what's important with the census money, the money that comes back, is the money that we use for infrastructures, the money that we use for SNAP, the money that we use for food programs and different variety Meals on Wheels. All this stuff that you don't see that goes on, and all the taxes that we pay in D.C. that don't come back, and the governor's done an excellent job of pointing that out, and thank you, Governor Cuomo, for doing that. I just wish people in the Senate and Congress would listen to the governor. I was supposed to do a surprise trip down to D.C. tomorrow to go lobby on this, just as my hat as President of County Executives of America and NISAC. We're all going down there because we are feeling it. And trust me when I say, if the Senate doesn't get their act together, it's going to be a major blow. I was going until I got that list. Someone asked me when I was coming in what took so long. I was trying to cancel my flight and was not headed to D.C. now because I'm not going to quarantine. Even though it was going to be a 24-hour trip, I was not going to quarantine for 14 days, so I'm doing the safe thing and staying here, the responsible thing. So I will say this to everyone, please get counted. It's so important. The people that were home, and we said this early on, take the 5 minutes to do the census training online, or not training, excuse me, just getting yourself counted. Just to give you a couple ideas, the national average is 58.3% responding so far. Albany County, 62, but higher than us is Saratoga at 64.5. Schenectady County's beating us a little bit. They're at 62.7. We are beating Rensselaer County and Steve McLaughlin over there at 59.8. So, but still, we want to get 100%. And, one of the things I think Mayor Sheen's done an excellent job counting people in the county, but building up, right? And if the city of of Albany got over that 100,000 population, they get federal dollars that they haven't seen since we dropped below 100,000 people here in the city. So it was crucial, and I think this was the year we were all hoping. I think last census we're at like 97,000 in the city, but now who won't be counting is the colleges, even though they're coming back, and we're doing this count later on, and they extended it. But a lot of students will be doing stuff online, and we won't have the opportunity to have them counted. So the numbers are going to dip, and I hope it doesn't dip below where we were 10 years ago. But I know Mayor Sheen was really pushing for this, and still pushing this with her staff to get it done. So my compliments to her and her team that are trying to get it done. But please take the time, fill it out, and you can go to the Census 2020 census.gov. And if you didn't fill it out, someone will be knocking on your door because they will be trying to check. Just please, they'll have their mask on, they'll have their PPE on, and just make sure you stay your 6 feet and answer the questions. It's going to help us, trust us, because we're going to need every dollar for this year and next year. Trust me when I'm saying that, because governments are going to make some really tough decisions if this stimulus package 5 doesn't come in. And as you're aware of, one of the things that has benefit was counties over 500,000. So counties that have been over 500,000 has gotten the CARE Act, and it's going to hurt us. It's going to hurt, and it's going to hurt the governor, and people are going to have to make really, really, really tough decisions, and probably quick layoffs and things like that, and concessions and all that. I talked to some of the union members yesterday. I plan on talking to all the unions next week, the presidents of all the unions, to discuss the situation that we are going forward, because again, we're all in this together. So I'm looking for solutions to the problems, not to add more problems to it, but we got to get through this and get through this together. I want to remind everybody our mental health support's available 7 days a week from 8 a.m. to 5 p.m. The number is 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Our United Way number, 211, and as always, the New York State hotline. And I want to just give a little special shout out to Maddie Donovan, who keeps sending me nice little messaging. So Maddie, thank you. I do appreciate that. And to everyone that sends little messages. But Maddie, thank you.